Okay, so let's speak a little bit about measles. So it's coming nowadays for some reason. So it used to be chickenpox, but the approach in both of them, the history, everything exactly the same, because both the post station is the patient is concerned about chickenpox contact or measles contact. So like if the patient been in close contact with someone, we need to check the level of exposure. Like they have to be in really close contact, like live in the same room together in the same house, and uh, like in one day they brought chickenpox, and the lady, she said her niece who lives in different country, different town, she had chickenpox. So they put like, just it was a trick. So just is all about reassurance. So you need to make sure they are in close contact with this person. Yeah. So just general information about measles. Um, Consider a diagnosis of measles in people presenting with a rash, fever, and other symptoms suggestive of measles. We'll speak about them. So rash fever, it's in chickenpox, in measles, both of them. So rash fevers. So we'll ask the patient, do you have any rash? Do you have any fever? So if you're concerned about something, we need to make sure you have the symptoms for these things. So it's logically to ask about any rash, any fever. And check the person immunization history is also very important. Immunization history, both of them, in measles, in chickenpox, we need to ask them if they are up to date with all immunizations they received, specifically the immunization for measles in this station or for chickenpox in the other stations. Measles is more likely in people who have not been fully immunized or have a history of measles infection, exactly like chickenpox. If like you are immunized or you have previous infection, it's unlikely to get it again. Yeah, also, so we'll check out these 2 points from the history, and we will reassure the patient if one of them exists, like if they have past medical history of these infections, or they being fully immunized. It's also reduce the risk. It's not like 100% they will not get it, but we say it's extremely unlikely to have it when you are fully immunized.
Yeah.
Because, yeah. The group most at risk are, yeah, the group that most at risk are adolescents and young adults. So in the station is young, so no problem. They determine whether the person has had significant contact with a possible case of measles. So this is really important point, significant contact. That is being in the same room for 15 minutes or more, or face-to-face contact. So, and this is exactly the same in chickenpox, exactly same period. So they have to be at least in 15 minutes in the same room together, like, or face-to-face to contact.
Okay.
Yeah. Consider, so this is also in the history, don't forget about the history of exposure and how, did you, have you been in close contact with someone with chickenpox, and for how long you have been together, and this kind of things, yeah. Consider contacting the local health protection team to find out if there is any localized outbreaks of measles. This is not, we're not going to add it to Plab 2, like to contact the local health protection to find about the area, like if the area they live in, if there is outbreaks there. It's not really, we can't waste our time in Plab 2 by this, but it's good just to know for the knowledge. Inquire if a person has recently traveled within the UK or to a country where measles is endemic. So just travel history, just any recent travel history or not. Yeah, just simple question, any recent travel history. Even we don't know which country's outbreak of measles, but just any history of recent travel, just make the history. Yeah. Ask about and look for the presence of typical features of measles. Clinically typical measles is defined as presenting with classical symptoms of cough, causal symptoms, and conjunctivitis, fevers of 39 degrees centigrade or more without antibiotics, and maculopapular rash. So exactly same like chickenpox, isn't it? So we have flu-like illness, corrosive symptoms with a cough, conjunctivitis, and we have the fever and the rash. The rash, maculopapular rash.
Mm-hmm.
Yeah, so the prodromal phase occurs 10 to 12 days after contacting the infection and lasts for 2 to 4 days before the rash become apparent. Yeah, so it's kind of giving you clue like about if the patient told you he was in contact, like in the history, we will ask when you have been in contact with this measles patient, for example, the patient has measles. So like if it is 10 days ago, this is the or if you less than 10 days and he doesn't have a rash, it doesn't exclude he has a measles because it's still the incubation period not finished. Yeah, so he can have few days to have the rash. So he said like it takes around 10 to 12 days after contracting the infections and last for 2 to 4 days before the rash become apparent. So it may take like 2 weeks or a little bit more to have the rash since the initial contact.
Mm-hmm.
Yeah. As I said, the symptoms: قلنا fever, malaise, cough, flu-like illness, rhinorrhea, conjunctivitis. Fever increases during the prodromal phase to around 39 degrees, so it's very high-grade fevers. And the rash appears and then gradually decrease.
Okay.
Complex spots appear on the buccal mucosa at the end of the prodromal phase. So we have Koplik, if I'm pronouncing right, K-O-P-L-I-K, Koplik.
Okay, Koplik spots.
Koplik spots. It appears in the buccal mucosa at the end of the prodromal phase around the same time as the rash and disappear over the next couple of days. So it doesn't take long time. This consists of 2 to 3 millimeter red spots with white or blue-white centers. So it's 2 to 3 millimeter red spot, and it has white or blue-white centers. These are pathognomonic for measles, but can easily be confused with other mouse lesions. The rash, as we said, is erythematous and maculopapular and may become confluent as it progresses. It appears on the face and behind the ears, so the major area, face, behind the ears, when other symptoms tend to be on their most severity, before descending down to the body, to the trunk and limbs, and for coming on the hand and feet. So it starts from the face and behind the ears. And we said also we have in the mouth, and it goes down to the trunk and limbs gradually after a few days. So the pattern of the rash starts from the face and goes down after that.
Okay.
Consider a different cause for the rash if the patient is likely to have immunity to measles. Clinical features are typical. There is no history of contact with measles or travel to measles, and there is no local outbreak. Like if you excluded measles, you can consider
Chickenpox.
for example, absolutely chickenpox. Yes. Hello, Riyadh.
Hello, Assalamu alaikum, doctor. How are you doing?
Walaikum assalam. Good, thank you. So we're talking about measles, just discussion, is not practicing. So we said it's exactly typical like chickenpox. The station exactly the same like chickenpox station. So just change it because I want to make some changes for you. So both stations is just about the patient concerned about contact with the patient who has chickenpox or measles, and we need to find out about level of exposure in the history, like they have to be at least in close contact for 15 minutes in the same room, or face-to-face contact, direct skin contact. So we will check about level of exposure. We also important point to check about immunity. Immunity either by immunization or previous infection.
Previous infection.
Absolutely, previous chickenpox or previous measles. So if this is the case, we just reassure. If the patient is not in close contact, for example, in chickenpox stations, she was telling her niece in different towns, and she wasn't in very close contact with her. So just in this case, we will reassure. And if she been fully immunized, also is unlikely to encounter chickenpox or measles. Or if they had previous infection, also we will reassure.
Okay.
All right. And the symptoms is the same, like flu-like illness and rash, fevers, and in this we will add conjunctivitis.
Conjunctivitis, yes.
Yeah. And also measles, they have complex spots in the mouth.
Yes.
Yeah, it's pathogenic, but it lasts for 2 to 3 for few days. So sometimes you don't find it, you don't see it once a patient, because it takes few days and then disappear. But if you find it, it's very pathogenic. It's 2 to 3 millimeter red spots, and it has white or blue-white centers in the middle.
Yes.
They describe it like salt in the mouth or something like that. Yeah. All right. Also, we said it takes like from the contact, getting contact with the patient, it takes around 2 weeks for the rash to appear. Like if the patient, you will find, like if the patient has concern about chickenpox or measles, you will need to find if they now have any symptoms of measles. So, but however, if they don't have, it doesn't exclude, because it takes around 2 weeks for the incubation period. Sometimes takes 2 weeks for the symptoms to appear and for the rash to appear. Okay. If there is any suspicion of measles infection, immediately notify the local
Health protection team.
health protection team. Thank you. And measles is a notifiable disease. Confirm the infection through laboratory investigation, but notification should not be await laboratory confirmations. So ask the health protection team about the need for testing kit and testing schedule. Usually an oral fluid sample will be required for IgM, IgA, or viral RNA testing. It's not really important to go into these details, but it's really important just to mention about health protection team. Okay, so management, how should I manage person? Let's say our patient has measles. How should I manage person with suspected measles? If not already done, immediately notify the local health protection team. Measles is notifiable disease, as we said. Seek immediate advice on management from the health protection team themselves. And if a person has a measles-like rash and is younger than 1 year of age, or pregnant, or immunocompromised, so also in the history, it's really important to exclude that the patient is not immunocompromised. Because in this, we need to notify the health protection team immediately regarding the management, because things can get worse.
Yes.
For people with suspected measles, advice, the measles that is usually self-limiting. So if the patient is not immunocompromised, so and even if they have measles, also we can reassure measles that is usually self-limiting condition, but is likely to cause unpleasant symptoms like rash, fever, cough, conjunctivitis. This usually resolve over the course of about a week. To rest, so we'll ask them, have rest, drink adequate fluids, same like anyone has flu-like illness, and take paracetamol or ibuprofen for the symptomatic relief. Aspirin should be avoided if the patient less than 16, you know that. For more information, all right, this is all about it. So treatment, bed rest, adequate fluid intake, and bed relief or ibuprofen. Also, you need to advise, like, avoid close contact with people who can be immunocompromised, like pregnant lady or anyone has any immunocompromised disease. Like just general advice, tell him avoid contact with pregnant lady or anyone who has severe illness at home, or pregnant ladies or infants. To seek urgent medical advice if they develop signs of or complication of measles. Complication of measles include shortness of breath, uncontrolled fevers, convulsions, or altered level of consciousness. So our safety netting will be, please seek immediate advice if you develop shortness of breath, uncontrolled fevers, or convulsions, or any altered level of consciousness. This is safety netting. Provide written advice, so patient information leaflets about measles and NHS website, whatever, just any patient information leaflet, more than enough. Follow-up is not always necessary, but consider contacting the person about a week after a rash to ensure that symptoms have resolved or resolving adequately depending on their circumstances and clinical judgment. When the person has sufficiently recovered from acute symptoms, encourage them to undergo any outstanding vaccination if appropriate, if they are not vaccinated. All right, as we said, like, just this is people who need to contact the local health protection teams if they are immunocompromised, pregnant, or infant less than 1 year or younger, and consider admission if the person develops serious complications as of measles, like pneumonia, neurological problems such as convulsion or encephalitis. That's all about it. Any question?